Option A, seated calf raise. Option B, leg press machine. Option C, single leg balance exercise on a verbal board. Option D, barbell squat. And the answer is option C, single leg balance exercise on a verbal board. Now let's move to question number 182. What is the primary mechanism of injury in quadriceps strain? Option A, direct trauma to the anterior thigh. Option B, excessive knee flexion with hip extension. Option C, sudden deceleration with eccentric overload. Option D, repetitive overuse without proper recovery. And the answer is option C, sudden deceleration with eccentric overload. Now let's move to question number 183. Which of the following condition is characterized by pain and tenderness around greater trochanter of the femur? Option A, trochanteric bursitis. Option B, iliotibial band syndrome. Option C, Osgood-Schlatt's disease. Option D, patellar tendinopathy. And the answer is option A, trochanteric bursitis. Now let's move to question number 184. Which of the following muscles is primarily responsible for adduction of the shoulder joint? Option A, pectoralis major. Option B, latissimus dorsi. Option C, teres major. Option D, deltoid. And the answer is option A, pectoralis major. Now let's move to question number 185. What is the recommended treatment for a grade 3, that's complete tear of ulnar collateral ligament UCL of elbow in an overhead throwing athlete? Option A, immobilization and non-throwing activities. Option B, aggressive rehabilitation exercises. Option C, surgical correction, that's Tommy John surgery followed by rehabilitation. Option D, RICE protocol and gradual return to throwing. And the answer is option C, surgical reconstruction followed by rehabilitation. Now let's move to question number 186. Which of the following exercise is recommended for improving hip mobility and flexibility in athletes? Option A, seated dumbbell curls. Option B, leg extension. Option C, dynamic stretching and firm rolling for the hip muscles. Option D, bench press. And the answer is option C, dynamic stretching and firm rolling for the hip muscles. Now let's move to question number 187. What is the primary mechanism of injury in stress fractures of metatarsal bones? Option A, direct trauma to the foot. Option B, repetitive overload with inadequate recovery. Option C, sudden deceleration with eccentric overload. Option D, excessive inversion or eversion of the foot. And the answer is option B, repetitive overload with inadequate recovery. Now let's move to question number 188. Which of the following condition is characterized by pain and tenderness around the ischial tuberosity? Option A, ischiofemoral impingement. Option B, piriformis syndrome. Option C, proximal hamstring tendinopathy. Option D, adductor strain. And the answer is option C, proximal hamstring tendinopathy. Now let's move to question number 189. Which of the following muscle is primarily responsible for extension of knee joint? Option A, rectus femoris. Option B, vastus medialis. Option C, vastus lateralis. Option D, all of the above. And the answer is option D, all of the above. Now let's move to question number 190. What is the recommended treatment for a complete rupture of the distal biceps tendon? Option A, immobilization and non-weight bearing. Option B, aggressive rehabilitation exercises. Option C, surgical repair followed by rehabilitation. Option D, RICE protocol and activity modification. And the answer is option C, surgical repair followed by rehabilitation. Now let's move to question number 191. Which of the following exercise is recommended for improving core stability and control in athletes with low back pain? Option A, seated cable rows. Option B, deadlifts. Option C, isometric abdominal bracing exercises. Option D, barbell squat. And the answer is option C, isometric abdominal bracing exercises. Now let's move to question number 192. What is the primary mechanism of injury in lateral collateral ligament sprain of the knee? Option A, direct trauma to the lateral aspect of the knee. Option B, non-contact deceleration with planted foot. Option C, excessive varus stress on the knee joint. Option D, sudden acceleration with eccentric overload. And the answer is option A, direct trauma to the lateral aspect of the knee. Now let's move to question number 193. Which of the following condition is characterized by pain and tenderness around the posterior aspect of the calcaneus, that's heel bone? Option A, plantar fasciitis. Option B, Achilles tendinopathy. Option C, retrocalcaneal bursitis. Option D, metatarsalgia. And the answer is option C, retrocalcaneal bursitis. Now let's move to question number 194. Which of the following muscle is primarily responsible for inversion of the foot? Option A, tibialis anterior. Option B, tibialis posterior. Option C, peroneus longus. Option D, peroneus brevis. And the answer is option B, tibialis posterior. Now let's move to question number 195. What is the recommended treatment for a severe inversion angle sprain with evidence of syndesmotic injury, that's high angle sprain? Option A, RICE protocol and early mobilization. Option B, immobilization and non-weight bearing for 4 to 6 weeks. Option C, surgical stabilization followed by rehabilitation. Option D, aggressive rehabilitation exercises without immobilization. And the answer is option C, surgical stabilization followed by rehabilitation. Now let's move to question number 196. Which of the following exercise is recommended for improving core stability and control in athletes with shoulder instability? Option A, dumbbell lateral raise. Option B, barbell bench press. Option C, close kinematic chain exercise like push-ups on an unstable surface. Option D, seated dumbbell curls. And the answer is option C, close kinematic chain exercises. Now let's move to question number 197. What is the primary mechanism of injury in a medial collateral ligament sprain of an elbow? Option A, excessive valgus stress on the elbow joint. Option B, direct trauma to the medial aspect of the elbow. Option C, repetitive overhead activities with impingement. Option D, sudden deceleration with eccentric overload. And the answer is option A, excessive valgus stress on the elbow joint. Now let's move to question number 198. Which of the following condition is characterized by pain and tenderness around the lateral aspect of the knee? Option A, iliotibial band syndrome. Option B, patellar tendinopathy. Option C, Osgood-Schulter's disease. Option D, trochanteric bursitis. And the answer is option A, iliotibial band syndrome. Now let's move to question number 199. Which of the following muscle is primarily responsible for external rotation of the tibia leg during the gait cycle? Option A, sartorius. Option B, gracilis. Option C, semitendinosus. Option D, biceps femoris. And the answer is option D, biceps femoris. Now let's move to question number 200. Which of the following exercise is recommended for improving hip and pelvic stability in athletes with patellofemoral pain syndrome? Option A, seated leg extension. Option B, prone hip extension exercises. Option C, lateral step down with resistance. Option D, biceps curl. And the answer is option C, lateral step down with resistance. So that's all for today. If you have doubts, please do mention in the comment box. Detailed explanations of each and every question is given